in the way that you do.
Thank you. I got a kick out of reading the hospital report by the doctors, and they, one said, I think it was, I was 56. Everybody knows my age because it was on the front page, but they described me as a pleasant 56-year-old woman with multiple machete wounds. And it's in writing, so.
So it must be true.
It must be true.
It must be true.
Speaking of gifts, I want to give you this.
Oh my gosh.
It's a homemade Christmas present. I haven't been able to do this for several years because of lack of hand.
Oh my gosh.
And I also have one for you, Shannyn.
Oh, for sweet. Well, we're at the end of the show, almost, at the end of this segment. And so you'll have to go online to see what we got. That's what you'll have to do. Thank you so much, Lenny, for everything you are, for sort of showing us. I think so many times we can be cut off in traffic. We can have somebody be crappy to us at work. We can have a governor that bans us from her book signing. Whatever you have that's a grudge. I mean, this is the end of the year. And if Lenny can drop hers and be a light of forgiveness and a light of gratuity to you, Trooper Borrego, we have none of us have any excuse to hold on to anything. I mean, that's really the gift you are right now. So thank you both so much for being here. I'm Shannyn Moore. This is More Up North. We'll be right back. More Up North. My name is Shannyn Moore, and I am so glad that we have such a great panel in such a momentous week. It is. It's a big week here in America with healthcare. If you think you got it, if you think you didn't, whatever it is. And we have a panel tonight that we've pulled together that I think really sort of represents different parts of this discussion. So I'm so glad you're here. Right here, Senator Hollis French. You might not have heard of him before, unless you've been in a cave. He was in charge last year of the Troopergate investigation, and he is currently running for governor, and he is the senator from the West Side.
I am, and nice to be here. Thanks, Shannyn. Nice to see you.
My pleasure. Glad you're here. And Dr. Monique Karaganis, Anchorage pediatrician. She is a board-certified pediatrician who obtained her medical degree in 2000, which included a 4-month stint with the World Health Organization in Geneva, Switzerland. And she taught at both the University of Illinois and the University of Colorado as a clinical pediatric instructor for both medical students and pediatric residents. The first thing she did once fully trained at Cook County Hospital was to volunteer in Bolivia, South America, and as an undergraduate, she studied medieval and Renaissance studies at Oxford. Jesus, you're way too smart for this show. Okay, we'll have translations at the bottom for whatever she says. And you're practicing here, and I'm so glad you're here tonight. And bringing up the rear, as he often does. Vince Beltrami, who is you are the first guest that we've had to be here twice. I could be mistaken, but I think you are. President of the Alaska AFL-CIO, which is kind of a union thing.
That's it. She had like a 10-minute description.
I know. Well, I'm sorry. Get a wiki page. I got a wiki page. You should have one. And he's also one of the Denali commissioners, right? Mm-hmm. So, which is fantastic. Mm-hmm. Why don't you tell us about that? We'll just start with you. Tell us, Mr. Denali Commissioner. I mean, this isn't about hiking.
Well, I mean, the Denali Commission, without going into too much depth, I mean, it was a federal law that created the Denali Commission. And we're out all over rural Alaska putting in health clinics and rebuilding bulk fuel farms, power plants, and doing a lot of good work, and have brought a lot of much needed relief to areas of rural Alaska that are hardest hit, both in terms of trying to deliver medical services as well as deliver affordable power, which we're still trying to crack that nut right now, but there's a lot of work to be done. And the Denali Commission does fantastic work.
And who exactly appointed you to that?
The Secretary of Commerce.
Really?
Yeah. The AFL-CIO is one of 5 listed commissioners in the statute, the president of the AFL-CIO, and also the Alaska Federation of Natives, Alaska Municipal League, the governor's representative, Associated General Contractors, And I think that about covers it. I'm probably missing someone. Sorry if I did.
They can wiki it. So, Monique, you're here, and I know that you've been at several rallies, and certainly the last several months, there have been a lot of, the teabaggers versus the people that want health care. And I've seen you a couple of times out. You've been very outspoken, and you're wearing your health insurance reform now sticker still. And certainly we've seen the Senate actually, they're passing this week to go forward. How are you feeling about that? Because you're still wearing your sticker.
Yeah, there have been lots of ups and downs. There's a lot of misinformation and a lot of fear-mongering that has really taken away from the message that this bill, as it is even today, will help Alaskans. And so focusing on the fact that this is a wonderful foundation on which to build and that that's a step forward is really important. So even for those of us that are disheartened or for those of us that still need to realize those benefits to Alaskans, I think it's very important to realize that the option to do nothing will come with blood on our hands. Like, people die every day because they don't have insurance. People die every day because they're underinsured. And in a country as wealthy as ours, in a country as capable as ours, in a democracy as strong as ours, there's no reason for it. And part of democracy requires compromise, and that's what you've seen in the bills. And so did we lose something? We may have. But we stand to gain a lot more than doing nothing.
All right, well, I want to discuss that
Sure.
at more length, certainly, because I kind of feel like I was, waiting for true love, and I got an arranged marriage, and I'm not really sure how that's going to work out.
But you're going to look like a lovely black bride regardless.
Oh, God. From your lips, not to God's ears, please. So, Senator French, I know that last year you had introduced Senate Bill 160, and this was to get health insurance for all Alaska. It was a universal health care, and you sort of let it go to a certain extent because you knew that President Obama and this Democratic majority, a mandate, if you will, was going to come in and do something. So how are you feeling about all of this coming up, and what exactly was your Senate Bill 160?
It was a plan, and I just want to say, I think the opening statement made by the doctor was one of the most cogent explanations of sort of the moral landscape that I've heard in a long time. It was quite remarkable. I want to compliment you on that. Really, really well done. The bill was designed really to.
Did you just say Vince's was okay too?
Yeah, I know. It's just
I
like,
didn't really think, well, I mean, it's just, I really like the doctors.
Just teasing. Okay, so
The
Senate Bill 160.
idea was to make insurance affordable for all Alaskans. That was sort of the key idea. It was modeled after the Massachusetts plan. We changed it significantly to make it Alaskanized. But at bottom, it's like the bill that just passed. It keeps the private insurance, companies in the mix. It essentially makes their products affordable for those individuals who have not been able to buy them on their own, and that's the bottom line. It forces the insurance industry to issue a policy to whoever comes forward and asks for one. That's a huge change that took place at the federal level. It's an enormous change. You can't drop someone who's sick. That's another exciting reform that I think has been overlooked, as many of us, more progressive reformers have looked for the public option as the way forward. When the public option went away, many of us got disheartened, but there are still significant reforms in this bill upon which future Congresses can build, and I think we're going to look back at this bill's passage as a pivotal moment in America's history, and it is very exciting. And the doctor is right. If you don't pass this bill, 40 million Americans don't have health insurance. If you don't pass this bill, 100,000 Alaskans don't have health insurance. And for those of us who do have the luxury of being covered, it's, I think, a little bit too. I think it's. I don't want to say condescending, but it's leaving those other people out in the cold as you wait for the perfect bill, and that's a bad approach.
And that's a luxury that a lot of people can't come to. I know I had Senator Begich call into my radio show this week and talk about this bill and say this isn't a perfect bill, which seems to be the meme right now. People are free to say, this isn't the perfect bill. This isn't. I agree. I disagree with Barack Obama that this is like a huge victory in the sense that, public option was taken off, single payer was taken off. But how can I, as an American, say, I'm not going to get covered by this, but 30 million other Americans will. So that has to be a victory. I mean, I can't take it away from someone else to make it my own. So it has been a difficult process to see the public option be dropped when, in conversations with Howard Dean that I had this summer, this was already a compromise. It really was. But I want to take this back a little bit. I know